The notion of universal health care, of course in the United States it dates back to President Roosevelt, not just Franklin Roosevelt, but Teddy Roosevelt. But really it dates back in a much more universal sense, believe it or not, to the 3rd century BC in India, where Ashoka said it was the duty of the state as a general ethical principle to subsidize health care, not for all sentient beings, higher beings, not just humans, but animals. He declares that he's going to establish everywhere 2 medical services, 2 state-subsidized medical services. And when he says everywhere, he really means everywhere, because he says specifically, well, not just within the boundaries of my kingdom, but also in neighboring lands. And he goes on to say, not only that, I'm going to promote and support the procurement and planting of medicinal herbs all over my kingdom and also beyond my borders. Sort of the supporting the pharmaceutical industry in the 3rd century BC, you might say. Well, obviously medical technology, system, society is much, much different. But the principle of thinking about what is the nature of society, what are the duties that the state and a collectivity owes its inhabitants, and those beyond its limits, on its borders. Ashoka thought about this, and he came up with a much more universal ethical imperative to health care, and as head of one of the world's most powerful states at the time, put it into practice, and it lasted for the better part of a millennium.